Nyantechwa, Emrebiam, this cabe for you, Pakume Busia for Ghana. No, me used to tap send, tap send. No fee mobile money transfer. Eye easy, eye convenient, eye fast, and sounds so free. Me discover ye mapim. Tap send. Intienne, also download the TAPTAP send app no ever mobile phone so free. Na first ka komo abusuya for Ghana fa na nyina. TAPTAP send. Papa no.
Mother's Day to all our Ghanaian and UK mothers. We love you.
That's it then. And many na TAPTAP for I run away. Nyami show mo TAPTAP for. Me show the say about download the TAPTAP send. Now or the send this car. The will be a TAPTAP home out. TAPTAP, you are the best.
After successfully redefining Accra's skyline with the delivery of the signature apartment, Cape May Properties presents an exclusive unveiling of the tallest residential building in Ghana, offering a first look of Sultan Sky. Sultan Sky, a magnificent representation of the seamless fusion of quality, groundbreaking innovation, and pioneering architectural brilliance. An extraordinary structure set to reshape the concept of upscale living, thanks to its inventive attributes and unparalleled commitment to precision. This master-planned residential development will focus on the building's location, security, privacy, the design's aesthetic brilliance, elevated features in each living space, cutting-edge smart home technology, and amenities beyond imagination, with fantastic residential features which include 24-hour concierge service, a state-of-the-art fitness center, a floating tennis court, a floating swimming pool, a spa, a sky pool, a sky lounge, a movie theater, co-working spaces, kids zone, distinctive lifts for staff and deliveries, private gardens, chef's kitchen, expansive terraces, entertainment rooms, restaurant, and 24-hour security. Sultan Sky, a new perspective in the sky.
Help to talk today. Your host. My name is Dr. Akos. I'm usually accompanied by my lovely sister, Lady Abena, and Dr. Kojo. However, they have asked me to send the apologies. Dr. Kojo is currently at work, and Lady Abena is unfortunately feeling poorly. So today, you're stuck with me, unfortunately, or fortunately. So, before we dive in, I'd just like to do a bit of sort of housekeeping. So thank you to our sponsors, TAPTAP Send and OT Media, for, of course, making this possible. Without them, we wouldn't have this show. So thank you very much. We also thank all our faithful watchers, everybody who's always here on time, Wednesday, 8 p.m. every day, every week. We thank you so much for being here on time and for supporting us. So thank you, Comfort. So yeah. So we're going to dive in quickly because today's topic I know is going to be really, really interesting. We've got Dr. Davies. He's on, I think I've seen him somewhere. So if you can just turn your video on Dr. Davis, and I think he's been here once before, so those who are faithful watchers will know him. He's a very good friend of mine. We work together, and he's a fantastic surgeon, but he's a consultant plastic surgeon, and he's going to talk to us today about everything you need to know when it comes to tummy tuck. So for those who don't know tummy tuck, I'm not going to say anything today because I'm not the guest on the show today. So I'm going to leave Dr. Davis to get it started. Emmanuel, are you there? Hello, Dr. Davies. Let me just give him a nudge because
tap send. Oh, I was my baby, you're from Calabos, the only boss. Wait, one is baby, I will be everywhere I day and everywhere they go. Tap send got me covered. It was therefore if you need to send money or transfer money from Europe, from Canada, from USA, from UK, any part in Europe, you can send it through tap send, and guess what? Oceania, they will receive it right here in Ghana and many countries across Africa. So what are you waiting for? Download tap send now on Google Play Store or App Store. When you download, it's so easy to use. Tell your families, tell your loved ones to download tap send. Okay? But also, when I receive my money, the other time I would have challenge, like my view, hey, you crazy.
Download tap send now on Google Play and App Store. Tap send. It's secure, convenient, easy, and fast.
Welcome back again. So yeah, no guys, sorry. Dr. Davies has been here. He was very punctual and very on time. He's been here since I think about 7:50. So obviously he just stepped out for a moment, and that was when I introduced him. So he is back with us. Again, as I was saying, Dr. Davies, consultant plastic surgeon, a very good friend of mine. He's here to tell us all about tummy tuck. So Dr. Davies, before you share your screen, perhaps we'd like to see your face just to say hi, just to, familiarize ourselves with who is giving our talk today. So if you're there, or are you able to show us your face at all? Oh, there you are.
Yes, I'm here.
There he is. So thank you.
Can you see my screen?
Yeah, we can see your screen. We can see your face as well. So that's double. That's great. Okay.
All right. That's fine. Oh, thank you. Thank you very much for this opportunity. Yes, and I'm sure Abna is in the background somewhere.
She's listening, and unfortunately she's not feeling well today, so she said apologies, she couldn't make it. And Dr. Kojo is at work tonight actually, so they both sent their apologies, but they're excited to have you on the show as always.
No problem. I'll still so I'll go ahead with my thanks once again for the opportunity to talk about tummy tuck. I know it's in vogue now. A lot of people have been talking about tummy tuck. But what's tummy tuck? I'm sure there are a lot of questions that will come after this. I'll just run through my slides, and then I'll try and explain as much as possible. I try to simplify it because I know that we have non-medics as well. And then at the end of it, I'll take questions, and then also we can all share our thoughts on tummy tuck. So yes, tummy tuck, as we know, as abdominoplasty, is a cosmetic surgical procedure that's done now most often by plastic surgeons. I know some general surgeons are able to do that, and then the other surgeons, like the gynae surgeons, were also venturing into doing these surgical procedure. And it involves removal of excess skin and fat from the abdomen, just to improve the appearance and the contour. As you can see with the pictures, it's not only done in men and in women. It's also done. Some men also come for tummy tuck. So the men out there, we are not left out. Mostly people come after their pregnancies, when you've had lax anterior abdominal wall, or their abdomen, which most people, non-medics, will say your stomach, but we refer to as your abdomen. After pregnancy, multiple pregnancies mostly, and then for those who had significant weight loss, and then as part of the weight aging process, we have some laxity. We lose fats elsewhere, and then the skin also loses its texture. So that results in some laxity, and then we are always on hand to tuck it in as we simply put it. A goal of abdominoplasty or tummy tuck is to attain a smoother and a firmer abdominal profile. As you can see, I'm sure, I mean, everyone can see my slide. And it involves removal of, but how do I achieve this? We achieve this by removing the excess skin and fat from the anterior abdominal wall, sometimes to the flanks. And then we also tighten the six-pack muscles, which we call the rectus abdominis. And then if for any reason you have any form of hernia in the anterior abdominal wall, we repair them. And the goal, I mean, the outcome of this is a very smooth, firmer, nice abdomen, which when you wear the fashion, the kente, when you wear your kente, your figure all comes out. So that's what we tend to do. And just for everyone to be aware of tummy tuck is not a weight losing surgery. It is not a weight losing surgery. It's for contouring, for improving appearance and contouring. It's not for weight loss. Because I've seen people come to me telling me, oh, I've tried all sorts of diets, I've tried all sorts of exercises, but I still can't lose weight. So I want you to perform the surgery for me. I have to, and I always tell them that no. If you have any problem or you attain a weight that you can maintain, then I can embark on that journey with you. But it is not for weight loss. So who can have tummy tuck? You need to be physically healthy. Your weight needs to be stable. We don't want anyone whose weight is wavering. You have fluctuating weights. One time you are 100, another time you are 80. You have to have a stable weight, and there's a reason for that. Ideally, we should have a BMI, which is your distance body mass index, which we calculate by taking your weight in kilograms and then divided by a square of your height in meters. And ideally, it should be it should be less than 30, not more than 30. Less than 30 is the ideal patient. Sometimes, if you go beyond that, we consider other factors. Non-smokers. It doesn't mean smokers cannot have a tummy tuck, but ideally, we should have someone who is not smoking, because smoking also increases your chance of cardiac problems, heart problems, and other issues, and then also can affect your wound healing. So as much as possible, we want the patient to be a non-smoker. If you are a smoker, we'll actually wait. We can postpone the surgery for a month or up to 6 weeks before the surgery is done. Clients will lose or sagging abdominal skin or abdominal wall. They are ideal candidates. And if you're not also planning for future pregnancies, because you see, when you tuck, what we tend to do is if you remember your six-pack muscles, which are also called the recti or rectus abdominis, we usually bring them together and then we tuck them with stitches. So when you become pregnant, when one becomes pregnant, the abdomen becomes loose and there's a lot of stretching, and all that we have done becomes loose. Even though you may attain some of the contour, but still you may lose most of it. So we try as much as possible. If you have any plan to have any pregnancies, we would actually advise you to go finish with the pregnancies and come back to us. And then we also want clients with realistic expectations. We don't want, people come with all sorts of pictures, images from the net. I want to be like this. When you can see someone with huge bones and they wants to be slimmer. Those ones we can't achieve. We are not God. We try to do, a semblance of some control, but we won't get there. So we want someone who has very realistic goals and expectations. So that's what we who are not or who is not an ideal candidate. I mentioned earlier unrealistic goals. People with body dysmorphic disorder. This is a mental disorder where people have some defects. The defect or they have let me say deformities which are not actually obvious, may not be obvious to people, but in their minds it's also obvious. I mean, I've had a patient who told me that his car could be seen like 100 meters away. If you have such a patient or such a client, you need to run away from that client. We need to discourage that person from having tummy tuck. And I mentioned earlier having plans for future pregnancy. If you smoke excessively, as much as possible. If you can't stop, that will be better. People with gross deformities of the abdomen or the torso. And then if you have scarring issues, for the dark skinned person and the Asians, we are prone to having keloids and hypertrophic scars. It doesn't preclude you from having a surgery, but at least you should be aware that there's a possibility that you may develop keloids. But it's not a problem for plastic surgeons. I mean, we can actively try to prevent it in various forms, but some of them can be very, very challenging. So at least you should be aware that there's a possible, for a dark skinned person, there's a possibility of getting scarring issues. And with massive weight loss clients, they will require more than regular tummy tucks. Moving on, you realize that we have different types of tummy tucks. But with a massive weight loss, you have a lot of loose hanging skin at the front, at the back, flanks. So the regular tummy tuck, which usually takes care of the anterior aspect of your abdomen, it's not enough for them. So we have to do more for them. And before we embark on the journey, we need to have a chat, find out if the person has had any previous surgeries, a pregnancy history, weight loss fluctuations. If we do, we may want to advise you to have some stable weight before we embark on the journey. And what we tend, if you have, and also what we realize is people who are obese, they usually have their muscle, the six-pack muscles being separated, what we call diastasis. If you have a risk of getting clots or what we call DVT in your legs, or we've had a previous history of pulmonary embolism where clots moves from some part of your body into your lungs, and then we are very, very we have to be very cautious, and you need to know the person's smoking status. As I said, it affects the wound healing. So that's hormone use. Females on oral contraceptives, we also need to know. And then if you have any medical issues, some of the medical issues will actually preclude you from having any surgery, because some of the tummy tuck usually lasts for between 2 to 5 hours. So if you have a heart condition that cannot sustain long anesthesia, then would advise you against having the tummy tuck. General examinations, usually we want to, look at your body habits, do a BMI. As I said, if your BMI is more than 40, we'll ask you to go on a weight loss, per diet or some surgical form before you come for say. Sometimes we consider those between 30 and 40. BMIs of between 30 and 40, but we are very cautious about that. But the ideal patient is a client with a BMI less than 30. Also, we also inspect the abdomen. If the abdomen has any previous scars that can affect the outcomes. We look at what we call diastasis. As I mentioned earlier, diastasis, we look at the six-pack muscles. They are usually firm together in younger patients. When someone becomes obese, multiple pregnancies, if you have any condition that will cause the abdomen to become big, the muscles become separated, and then it causes the girth of the abdomen to be bigger, which some people are not comfortable with. So after that, we do what we call the diverse test. So the diverse test is on the right bottom, where you stand, and then as if you're going to dive from a board. So if you have excess skin at the lower part of the abdomen, then you are a candidate for tummy tuck. And then also, if you can see from the pinch, what we call the pinch test, we try to hold the anterior abdomen to see how much of excess skin one has. Such people also have, they're also ideal candidates for tummy tucks. These are investigations that we do. We have to make sure that you are well, you can survive the anesthesia. Imaging ultrasound is that sometimes the girth or the increase in abdominal girth is not just from the anterior part of the body. It can also be from inside. For those of us who have fibroids, there are some people who have increased size in their liver, we call hepatomegaly or splenomegaly. They can also, and then some people also accumulate fat around their intestines. Those ones we can't perform surgery. Tummy tuck will not help. You need to lose weight, and when you lose weight, that fat also goes away. So we need, sometimes, in some cases, we opt for CT scan just to make sure that you don't have any hidden abnormalities in the anterior abdominal wall. Yes, the types of tummy tucks. We have the traditional one, which we call the full abdominoplasty. We have the mini tummy tucks, and we have the extended ones. So this is a traditional tummy tuck, which usually involves the lower and upper abdomen. Well, what happens is, after all the preparation, patient client is put on it. We'll see anesthesia. The anesthetist will assess, make sure you are well enough to undergo the surgery. During surgery, mark the excess areas. So you can see from the first picture, number one, the area that has been marked up to the umbilicus at the level of the navel. And then what we tend to do is we make a bikini cut long enough to the side of your flanks. We raise it just to expose as much as possible to expose the six-pack muscles. So if we notice any hernias there, we'll repair them. If we notice the separation of the six-pack muscles, we tag them together. And we tag them together in a way to have a very flat tummy. After that, where a patient is put in what we call the beach chair position, where you have your hip flexed and your leg flexed. So this is the demonstration of what happens. When you do that, we are able to re-drape the excess skin on the anterior abdominal wall, and then the excess one is excised. You can see the mark for number 5. So when you bend the bed, and the cut can be made at that point, at that level. You notice the amount of skin that is shed off, and then we'll put the skin together. Not forgetting the umbilicus or the navel. The navel, we reposition it, and as much as possible. Naturally, in about 1.5 or 1.7, let me say about 2% of people, their navel is not in the midline. We think it's always in the middle, but there's some asymmetry with us. So if for any reason we put the navel at the point where it's slightly deviated, it's still a good outcome. Don't be too worried about it. And you end up with a bikini scar. In some cases, when they have what we call love handles, we are able to perform the surgery together with liposuction. So what we tend to do is we do the liposuction first, and then we finish off with the tummy tuck. So the next one is a mini tummy tuck. This is for people who really they have excess skin at below their umbilicus, and the top part is fine. They don't have any excess. The skin, they don't have any excess fats at the top part of the abdomen. That's above the navel. But what we tend to do is just make a small, and then they usually will end up with a smaller scar. So we just make what we call a melon slice. So if you look at the shape of we make a small incision at the lower abdomen, sometimes you may repair the muscle. The muscle is separated, but this one can be done under some local anesthesia. You don't have to be put to sleep. You just inject around the area, and then some slight sedation to make you a bit woozy, and then we'll finish off the surgery. And as I said, you just end up with a fine short scar. It's not like the full or the traditional tummy tuck where you have a longer scar up to your flanks, but they usually at the bikini level or at the pants level, so it may not be obvious when one is wearing the undies. The extended ones are several. One of them is what we call the circumferential one, or the belt, and it's usually for those who've lost weight massively. So you have hanging skin at the front of your abdomen, at the back, and it doesn't look nice. And usually we'll take that bit around the torso, your trunk, 360 degrees. So this is how it looks like. From the front to the back, and then we re-drape so all the skin. So the area that goes is the shaded areas, the pinkish areas. And then after that, we'll bring all the skin, that is light colored, back to the area. So you end up with a very nice contour and appearance. We have what we call fleur de lis for those who have excess skin. Sometimes it's not easy just bringing down the skin. Sometimes you have to make an incision or cut the flesh in front just to improve the contour. But the disadvantage of this is that you end up with a very a scar that you may not like. I mean, with the fleur de lis, you end up with an inverted T. So you won't have just a bikini line, you have another one just in the middle of your abdomen. Some people do not like, but for those who've lost weight massively, they are content with it, and we are happy. But we don't do it for everyone. It's just for those who've lost weight and to improve their contour. That's what we call the reverse tummy tuck. Usually, from the traditional one, we make an incision at the lower part. But there are times where sometimes the fullness is at the top, or for those who've had some form of tummy tuck already, but they still come with some fullness of the top. So what we try to do this time, we do it's a reverse. So we make the incision at the top of the tummy rather than at the bikini level. And sometimes it can be combined with breast surgeries, breast reduction surgery. So you can see that this patient has had some form of breast surgery, and we tend to hide the scar just below the breast, what we call the inframammary line. So you may not see, if the person is standing with the breast a bit droopy, you may not even notice the scar. And some cases, just to improve the contour at the sides, we also perform liposuction. How do we recover from tummy tuck? Well, as I said, tummy tuck can last for between 2 to 5 hours. Usually, averagely 3.5 hours, and it depends on what you are doing. So if you are combining it with liposuction, then the duration is longer. Usually after surgery, you wake up a bit, drowsy. You have to be resting in flexion, like a beach chair position. But after 1 or 2 weeks, by 2 weeks, you'll be upright. We try to encourage clients to be out of bed as early as possible because of complications that can arise. They feel a bit bruised and some discomfort at the top of the abdomen. They feel a bit numb, but that's all normal. And the swelling can even be more when you've had liposuction, because with liposuction we tend to infuse some fluid just to reduce the amount of bleeding that can occur. And one also wakes up with drains. We have tubes that come sometimes from just below your bikini line or at the mons pubis, or from the sides of the scar. And what we tend to do is leave those drains in for a while, So any collection of fluid, any blood any residual blood can come out through those drains, and we keep them till they come to a minimum level. Once they are at that minimum level, we are happy to take them out. As much as possible, we want to keep them within 3 to 5 days. Sometimes, in some cases, or in rare cases, we tend to allow patients to go home with the drains, but under caution. And then sometimes we also send nurses to their homes, or they come for regular reviews. Breathing exercises are very, very important. Because of the long prolonged surgery, sometimes some parts of the lungs, or the lower parts of the lungs can just close up a bit. So you need to breathe in and breathe out. And the breathing exercises are also very important to prevent clots from forming in other places. What we call test stockings, one of the precautions we tend to do, we wear these socks, they prevent clots from forming in the legs. During surgery, we have what we call the pneumatic compression. There are some sort of a machine that compresses the calves whilst you are asleep, to improve blood circulation and to prevent clots from forming, which we don't we want to prevent. So this is an example of the test stocking. Some of them are longer, they go above the knee, but the ones that end up at the calf are also very good. So this is a picture showing drains from there's a bikini line. We keep them, as I said, between 2 to 5 days. As much as possible, we want to take them out before client goes home. After surgery, yes, you want to keep the shape. We want to reduce the swelling. So we use what we call the binders, the abdominal binders. We use these ones so we remove the drains. So they have space. If you have the drains coming from your side or from the front, we don't have any problem with it at all. The drains and the dressings can be changed without any problem. But as much as possible, you need to wear these bindings. And then after the drains have been removed, we move on to what we call the faja, or the compression garments. These are different types of them. They tend to hold the abdomen in place, improve the contour, to improve the fluid, improve the fluid drainage. And we advise that patients will wear, I'm using patients and clients interchangeably, but that's okay. Clients will wear them at least every day for 6 to 8 weeks. For 6 to day and night, unless you take them off when you are going to have your bath. After that, you wear them. And then thereafter, some will stop wearing them. Some can also wear them just either day or night for another 6 to 8 weeks. But it depends on the clients if you are comfortable wearing. But some, because they still, what happens is after full recovery usually would occur between 1 month to 1.5 months, 6 weeks. And this continues, the shape, the contouring improves as the months go by, even up to about between 6 months and 1 year. So some will want to still wear their faja or their compression garments till that time. For when you embark on any journey, there are possible risks. Some of the risks are minor, some of them are major. But because we know, or we can anticipate them, we put in several measures to prevent this. And just for us to be aware, not to scare anyone, these are complications that can happen. What we call hematoma, where you have blood collecting in one place under the skin that has been raised. But when you have liposuction, the fluid that is put in also has adrenaline. We are called vasoconstrictors. They prevent the blood vessels from opening up, and then that controls bleeding. What we call seroma. Sometimes you feel like there's some fluid around the abdomen after surgery. In some cases, we go back and drain it. We put some few needles, a bit nippy, but they are not so much of a problem. Sometimes if they are minimal, we leave them. Because of the trauma to the fat under the skin, sometimes some of the skin can die of what we call fat necrosis. If it's minimal, we leave them. Most of the time, we actually leave them and observe them over 6 months to a year, and they don't cause much problems at all. So, and then if they have issues with the wound, sometimes the wound may gape a bit. Minor ones, they heal after a while. Major ones, sometimes we go back to theater to put them back, but mostly they tend to heal without any much issues. The major ones that we need to make a note of is the DVT, what we call the DVT, or the clots forming in your calf that can move, the deep veins that can move. It can also form in the arms. You can have DVT in your arms, and then it can move straight to the lungs, what we describe as pulmonary embolism. But to prevent this, we usually give blood thinners. Clients will wear their test stockings, and then the breathing exercises, and then we try to get them out of bed as early as possible. How do you do that? Make sure they get adequate pain relief. Once you are not in pain, you are more comfortable to get out of bed. And those are the things, because these ones, we don't want them to happen. When they happen, it can be quite dangerous. Respiratory issues, with prolonged stay in hospital, some may develop respiratory infections, but they can be treated with antibiotics, and most of the time they tend to do well. Benefits of tummy tuck, as I mentioned, flatter, firmer abdominal contour. So we can wear our nice outfits, improved self-confidence. But if you want to have long-lasting results, it's not just the time. If you decide to go back on improper diet, not exercising, just eating anyhow, you increase in weight. And the fat will accumulate, as you know, fat will accumulate in abdomen, then the flanks, and you come back to the square one. So if you want to maintain or have long-lasting results, then you need to maintain that weight with proper diet and exercise. And just to re-emphasize that tummy tuck is not for weight loss. It's just for contouring and improving appearance. So I'll just show you a picture of two pictures of two clients that we've done with their permission. So you can see on the left, client who has a tummy and a bulging tummy, has had tummy tuck, re-draped. You can see the tummy has become flat. If you compare the profiles at the extreme ends of the pictures, you realize it's become flatter. They usually have a longer scar, but the scars, they tend to heal. This is a fresh, it's like 5 days after surgery. So it's looking, but they usually will settle without much problems at all. And the umbilicus and the navel has been repositioned, and it's looking very nice. We have different ways of doing them, depending on what you want. Usually clients do not do request for any special type of umbilicus. But I will try to give them a small, very nice and appealing one as much as possible. This is a young patient who has gross diastasis of the muscle of the six-pack muscles that we had to bring because of multiple pregnancy. But she also had a lot of stretch marks. So what we tend to do sometimes when people come to you with a request that I want to have a tummy tuck and I want my stretch marks to be removed. No, when you develop stretch marks, some people can develop stretch marks. They are prone to stretch marks. There are people who develop it from medication use, like using topical steroids. Some of these whitening creams can also cause their skin to become thin, and then they will develop stretch marks. Some of the stretch marks can fade. But surgery doesn't remove stretch mark. what happens with tummy tuck is there's the stretch marks that are originally below the navel or the umbilicus are excised, but the ones on the top, at the top and the flanks don't get removed. So they still stay there, unless you want to use any, or you are fortunate to use creams that will make them fit. So this is just to emphasize the point that tummy tuck is not surgery for stretch marks. But if it so happens that your stretch marks are within the area where there's excess skin, then that can be removed. So in summary, tummy tuck surgery is safe and very effective for abdominal wall contouring. It's best suited for those who have, pardon me for the wrong spelling of loose, for those with loose skin and weakened anterior abdominal muscle. And as I've said previously, it's not a substitute for weight loss or for healthy living. You have to have a healthy lifestyle to maintain a result of tummy tuck. Thank you very much, and I'm open to any suggestions, any contributions, and questions.
Thank you so much, Dr. Davis, for that very extensive, well-explained talk. I felt like I was back in medical school there, but it was really good. Thank you so much. So for our faithful watchers who usually know how this runs, this is a time where we'll go on a short advert and then we'll come back with some questions. I noticed that there are 5 people watching on YouTube, or maybe more now, and there are some people watching on Facebook as well. I am keeping up to date with the Facebook and the YouTube pages as well. So if you've got questions you want to ask, just put it in the comment and I will read them out so that Dr. Davies can answer your questions. Also remember that on this show, yes, we have talked about tummy tuck today, but this is the only show where you get medical doctors, myself included. So we've got Dr. Davis, we've got myself here, and you've got a plethora of healthcare professionals on this show as well. So if you've got any other questions about anything else that is not related to tummy tuck, that is totally unrelated at all, you can still ask and we'll do our best to answer all those questions within our remit. Okay, so thank you very much, and we'll take our adverts now. When we come back, we'll take the questions. Thank you.
My chef and party planner. You know we can't get this retirement/birthday shindig go wrong. Everything is almost ready, but small problem.
Why, what's up?
We are way over budget, Kweku. Everything is almost twice the estimate.
Alibaba, okay? No worries.
So with TAPTAP Send, I have got a cake and decorations covered for the year.
You handle the food.
If any extra expenses comes up, just text me or call me.
I'm off today, so I should be easily reachable.
Hey, Chairman, it is for
Say, don't be easy, you. Chairman has time and money.
Allah,
Kweku tap, Kweku do, Kweku that.
I Chairman can't call.
Hey, Alande, Chairman send them.
Tap send. Papa no.
Mother's Day to all our Ghanaian and UK mothers. We love you.
After successfully redefining Accra's skyline with the delivery of the signature apartment, Cape May Properties presents an exclusive unveiling of the tallest residential building in Ghana, offering a first look of Sultan Sky. Sultan Sky, a magnificent representation of the seamless fusion of quality, groundbreaking innovation, and pioneering architectural brilliance. An extraordinary structure set to reshape the concept of upscale living, thanks to its inventive attributes and unparalleled commitment to precision. This master-planned residential development will focus on the building's location, security, privacy, the design's aesthetic brilliance, elevated features in each living space, cutting-edge smart home technology, and amenities beyond imagination. with fantastic residential features, which include 24-hour concierge service, a state-of-the-art fitness center, a floating tennis court, a floating swimming pool, a spa, a sky pool, a sky lounge, a movie theater, co-working spaces, kids zone, distinctive lifts for staff and deliveries, private gardens, chef's kitchen, expansive terraces, entertainment rooms, restaurant, and 24-hour security. Selton Sky, a new perspective in the sky.
That's it there. And then many na TAPTAP for Abraham way. Tinyami show mo TAPTAP for. The show the say about the TAPTAP send. Now or the ascend this car. The there will be a TAPTAP home out. TAPTAP, you are the best.
I can say one to three. Okay. Okay. Once again, welcome to the OT Media Health Show. Once again, thank you, Dr. Davies, for your brilliant talk. And I can see that people are burning with questions because there's so many questions in the chat already. But I'm going to ask a few on my phone first. And again, as I said, I can't actually see that you can comment on YouTube. So studio team, please see if there's a way that people can comment on the YouTube, and so that I can get comments on YouTube, because there are people watching YouTube as well. Okay, fine. So before we come into the chats, I want to ask a question myself, because I keep on all the pictures. I've realized that the pubic area and underneath is all shaved. When after in the surgery pictures, do you need to fully clear the region prior to the surgery, or can you just clear maybe half and leave half? I'm just curious.
Well, as much as possible, we want it shaved, but we usually would want it shaved just, or ideally to prevent infections and all. The ideal situation is to shave chest before surgery, or within 30 minutes, or even in a theater. Actually, literature, with a lot of literature says we have to shave to reduce the risk of infection, shave on the table. But sometimes it's not, as having people in the theater getting shaved can be it doesn't look good. So we tend to get them to shave just. We have private suites, so they can shave there before surgery. So the nurses will help them shave before they just get into theater. So that's no problem at all.
That maybe this is a conversation for another, because I'm very curious. Why the shaving on the anyway? That's never mind. I'm just getting very curious now, right?
Yeah, okay. You're annoying and just.
I'm just thinking, why is shaving on the table actually, does that rather not risk infection? Because then you get hair.
No. That's actually because when you shave on the table, usually when you shave before, then you can have cuts.
Okay, fine.
You have cuts, yeah. So when you have cuts and they are exposed before you come to the theater. Okay. But when you are shaved in a theater on a theater table, we use antiseptics to clean it just after the shaving, and after, as much as possible, try not to get give you any cuts.
I see. Okay, so it's actually not infection of the actual wound, is like pre-drone infected. Okay, I get it. I understand. Fine. Yeah. Let's move on. Okay, so I've got a question here which talks about. Wait, let me just bring it up. Somebody sent me a message. When you talked about the fahas and the sort of the body shapers, when you do, is there a particular type that you recommend, or are these provided? Can people purchase this as extra, or do you know? I mean, what's the process with that, with the body shape?
So it depends on who is doing it. For me, what I tend to do is The initial one, I will provide the binder. So, but the fahas are bought by the client. So you buy the one of your choice. But also, it also depends on what has been done. In some cases, if you've had liposuction, sometimes some people do so many things at the same time: tummy tuck, liposuction, and also do BBLs. So with that, when you have a BBL done, you don't want to put too much pressure on the BBL. So you don't want to wear something that would cover your legs or your bum. Because when you put pressure on the fat that has been transferred there, you can kill the fat. But mostly, whatever you are comfortable with, the faha, whatever you are comfortable with, is okay. And we don't. I mean, the binders we have, the faha you buy on your own, and there are several ones and some people want to have more than one because you're going to wear them. You're wearing them 24 hours. You understand? So we may sweat into them. Sometimes the dressing, when you're changing the dressing, may have a bit of ooze into your dressing. So we may have more than one to change at every time. And you wear them 24 hours. Only take them off when we're going to have your bath.
Okay. Yeah, I mean, I guess I was asking that question because the person asking the question was thinking because there's so many out there, there's so many on Amazon, eBay. Even you're in the UK, if you're in Ghana, I don't know what the options are, but at least is there a recommendation of a vendor to get it from so that you know that what you're getting is a quality one, or is it just anything goes?
So we don't. Well, most of them are. So what we tend to do is before we have surgery, I will talk to you. If you have the faha ready, we'll have a look at it, and then our nurses are also well versed in what type of faha we want. We don't want too tight, because if you have a faha that's too tight, then there's some swelling just after surgery. So we don't want it too tight, and if it becomes too tight, you may have some areas of necrosis or become sore. Let me simply put it. You may have areas that become sore because of the excessive pressure there. So something that is holding the body shape, and as you go along, the swelling goes down. If you want to, some of them are actually adjustable, so they have locks at the front where you can adjust them. So it depends on which one you are more comfortable with.
Yeah. Okay, thanks.
And then my nurses will also help you with the type of
as per usual, our beautiful nurses. Okay, if anybody missed, again, just joining us a bit late. Today we're talking about tummy tucks, everything you need to know about tummy tucks. We've got a lot of questions in the chat, so I'm just going to crack on with them. So somebody says, how much is it? And can someone with a benign fibroid do a tummy tuck? So that's two questions in one. But I'm sure everybody's dying to know, and I know the answer is not going to be just a simple answer.
So I actually thought about putting up a price range, a slide with a cost. But I see, we look at a lot of things. I mean, it depends on whether you're going to have a liposuction and in addition to what the tummy tuck. But averagely we look at so it's between 55,000 Ghana cedis up to 95,000 Ghana cedis, depending on what is being done for you. So if you add more, and then some will want to have liposuction of their back, of their back, and then the front, then the tummy tuck. So it depends on how long surgery is going to take, and then what were the components of what we are going to do for you. And yes, you can have time. Actually, some people actually we do perform this surgery with a gynae. So we gynae surgeons or gynecologist comes in, does the fibroid surgery, and then we carry on with our tummy tuck. We usually will even start because of our incision. We want to make the cut at the level where when we close up, you still have your bikini scar. So we start, and the gynae will come in, finish up either the hysterectomy or that's taking out the whole uterus or your myomectomy, and then we come back and finish. Because sometimes some of the bulginess is actually coming from the fibroid uterus. So once they have it done, it makes the lower part of the abdomen flatter.
Yeah, and I guess so I guess that answers the question in a way to say that yes, you can have
Yes, you can.
get a double surgery, but in a way that obviously fibroids. Never mind. Let me not. Never mind. I want to ask.
Oh no, I mean, say yeah. I mean, I wanted to add that there's a yes, you can have it, but it means there are risks to that because it's a longer surgery because the gynae has to finish first, so it may take up to 6 hours to have it done. And then there's a requirement for some blood. There's a possibility of blood transfusion with that as well. So
I guess I was rather going to say that I know that fibroids can come back, but I guess if they're taken out of the whole womb, then that's
if they're out the whole womb,
but if they're not coming back, just taking the fibroid, then there's a chance that obviously it might come back, isn't it?
So those actually do, we always say that if you are planning to have future pregnancies, then we advise you not to have the tummy tuck. So if you're not going to have any future pregnancies and you're going to have your womb taken out, then that's the best option. So once it's taken out, you have the tummy tuck and then you are good to go.
Okay. On that note, I'm gonna come back to the chat, but there's somebody asking. I know you've worked in the NHS before because obviously that's where we met. So I don't know if you'll know this information. Perhaps you will. But are tummy tucks available on the NHS? And if so, what and for
so
people
in the UK, yes, you have to go through the system. I've forgotten what it says where and the waiting list there is quite long. I mean, if you go, you have to go for mental health assessment and all these. But unfortunately, in our part of the world, no, but it's all out of pocket. We have a lot of issues that are not even being catered for by our health insurance. So it's out of our health insurance. I mean, health insurance cannot pay more than 10,000 per patient. Yeah.
Okay, thank you. John Agbe, our very faithful watcher, honestly, love this guy. He's always here way before I even come on. He's like, very dedicated. So just a shout out to you. Thank you so much for being a faithful watcher of the show. But he's also asked a question and he says it's very insightful. So that's to you, Dr. Davis. Thank you for your insightful talk, especially on tucks and weight loss. So focus on the prevention of FUPA, which I think it's got something to do with fat of the upper pubic area, maybe. I think that's it. Focusing on the prevention of the FUPA, what's your topmost advice?
No, I mean, with fat, you can't really tell your fat where it has to accumulate. We have people, we have females. We know where common places of accumulation of fat. I mean, for males, abdomen. For females, their hips, the abdomen. And then, as I said, I mean, during my talk, I also mentioned that sometimes the fat can accumulate around the intestines. That can also give you that bulge. So, and around that area, actually, let me tell you something. Sometimes some people don't even they want to have it very puffy. If you understand, they want it puffy. Don't want it. So, in some cases, we do some form of liposuction just to reduce the size, because when a tummy becomes flatter, it becomes more pronounced. So you can just do some minor liposuction to take it off. But in times where some clients have complained that they never told us to take it down. So we actually would ask you whether you want it down or you just prefer it to be same size. So I mean, as I said, once you lose weight and you live a healthy lifestyle, wherever you have fat accumulated, the fat will be lost. So that doesn't really. You don't really have a particular exercise or a particular advice for that.
Yeah. And having said that, I'm just going to plug next week, because next week we've got a dietitian/nutritionist coming on to come and tell us about how to eat healthy and how to, so if you want to know how to lose weight before you contact Dr. Davies about your tummy tuck, it's worth coming next week to come and, hear about that from the dietitian. So our next question, actually, before I get to the next question, I'm going to ask a pre-question, which is, can you tell us the difference between a liposuction and a tummy tuck? Because you've used both, sort of almost saying.
Okay. So tummy tuck is when you surgically would remove the excess skin and fat at the anterior abdominal wall. So it's like redraping The answer is, so like when you are wearing shirt, you are tucking your shirt, take out the shirt and tuck it in where. So we just imagine that the part that has gone into the pants are the areas that have been excised. Mm-hmm. With liposuction, we actually suck in the fat between the skin and your muscle. So we usually make small incisions or make pinholes at various areas. So you don't really cut the skin. You just make small holes in the skin, and then you use a machine or what we call it. We make and then we use a machine to suck out the fat under that. There are various ways where by which they can be done. The one that we do is the manual one, but there are machines, what we call the power assisted ones. We have the ultrasound ones. We even have laser assisted ones, which makes it more. With the manual ones, we use a lot of effort to do that. So you can have liposuction for younger patients who do not have excess, who have fat parts at different points and anti-abdominal wall, their love handles. You can just go for liposuction without necessarily having a tummy tuck.
Okay, that's brilliant. Good to know. Also, I realized a lot of people writing in the chats, and today I'm not getting a lot of hands raised and personal questions. Please, today, so you can still come in, still ask your questions. So raise up your hand, and we'll call you to ask your own question. You don't have to type it, so just bear that in mind. And next question is from Fanny, who says, if you want to reduce weight, do you have to do a liposuction before doing the tummy tuck? I think you've probably already touched on this. But
yeah. So liposuction and tummy tucks are not for weight loss. You lose the weight or you get to a weight that you can maintain. And ideally, as I said, we use what we call your BMI, which is your weight over your height squared. Ideally, it should be less than 30. If it's between 30 and 40, you may consider having the surgery. But if it's above 40, which is a morbid obesity, no, you will have surgery. We want you to lose, and we want you to get to a weight where you can maintain. So when you have your surgery, so let me tell you guys something. If you have the liposuction or you have the tummy tuck at a weight that is above the weight that you normally maintain, when you lose weight, you develop excess skin again that may require further surgery. That is why we advise that you have a weight that you can maintain. Then we can embark on that journey.
Right. So our next question is from Ma Boot, who says, can someone who is stage 3 asthmatic have a liposuction or a tummy tuck? So I guess this comes from the pre-assessment.
Yes. So the assessment, as I said, if you have very severe condition, a heart condition, asthma, so what happens is when you do the tummy tuck, it's like applying belts or wearing your corset. Let me say the corset. Sometimes you cannot breathe well until you release your corset. So if you have somebody who has issues with respiration already, or has an asthmatic who's been having recurrent asthmatic attacks, or that asthma is not well controlled, I would advise against that. But most importantly, we get you to see our able anesthetist who would assess you, and if for any reason they think they can handle you during the surgery, the 2 to 5 hours during the surgery, and after surgery, we are happy to have the surgery.
Okay. In terms of, I know you spoke about the BMI and obviously needing to have less than a BMI of 30. So if somebody was above the BMI and they really wanted it, would you, if during the consultation, would you say something like, okay, go and lose weight and come back? Is that an option?
Yeah, so sometimes you actually motivate the patient by telling them to calculate the BMI. So we realize your BMI is about 35. We look at your weight, and then based on your body habits, we tell you that, okay, you get to 32 or 33, or just let's say about 31. Even though it's more than 30, you can still have the surgery. So based on that, we can calculate your weight, the target weight. and they ask you to get to that target weight and make sure you can maintain that target weight and you come back to it. And I mentioned, not forgetting that there are some clients who are morbidly obese. Those ones, because of the high risk involved in having tummy tucks, we don't do them. But we can have weight loss regimes, non-surgical and surgical. The surgical ones are when they reduce the size of their tummies or do all this banding. So those ones are handled by the general surgeons. So once they have that, they lose a lot of weight. They have a lot of sagging skin, and they come to us. Those ones, usually when they come, you have to operate on their arms. They have the 360 lipectomy or the belt tummy tuck, as I mentioned earlier. You have to go, the males, you even do breast surgeries for them, breast reduction surgeries for them. So it can be quite a number of surgeries. But as much as possible, get to a weight that you can maintain, get to a healthy weight, and then live a healthy lifestyle. And if you're on any chronic disease, once the condition is well controlled, then we don't have any issues with having the tummy tuck.
Fantastic. I'm mindful of the time, so I'm going to take the last 3 or 4 questions, depending on how I'm feeling. If I can just get Dinah or Dina to come on, and if you're around, can you come on and explain what you mean by muscle weakness? If you're happy to do that, just lift your hand and I'll call you for the next question. But before I come back to you, Auntie Gifty is asking, how long does a lipo alone take? So you said 5 hours, did you say, for the tummy tuck?
Yeah, sometimes, 2 to 5 hours, depending on smaller, if you have a smaller body habitus, within 2.5 hours, we are done.
This is dependent on your bodily habitus. So
exactly. Yeah.
All right, Dinah, are you there? Can you answer your question before I go to?
So I'm guessing the person wants to talk about that in a muscle. Yeah, I'm guessing the person is talking about the muscle weakness, the 6-pack muscle weakness.
Oh, right. Okay.
If that's what the person is about, yeah. If that's what the person is talking about, then yes, what we tend to do is, because I spoke about the tucking the muscles together and then excising the excessive skin. So when we tuck the muscles are separated from each other, which can happen during obesity, multiple pregnancies, or if you've had any condition in abdomen, the muscles will get, or in some cases, they maybe have had some hernia. You may have the hernia repair and have the tummy tuck done.
Okay. So I guess, I hope that answers your question. If not, please do come back and elaborate. And then the last question that I was going to ask, I've lost the question now. What does it say? But I've got quite a few questions here. So
no, you can go ahead. I'm happy to answer.
Oh yeah, this one. It says, how should I? It's 2 in 1. So it says, how should I wear my wrapper or waist beads after surgery? And then it says, can I still dance, bend, or do chores after surgery? And I guess this is not immediately after surgery, but I suspect after you've recovered, are you restricted in anything that you can do?
So what we tend to do, we tend to advise is that first 2 weeks. So after tummy tuck, you'll be slightly bent, and then as the time goes on, days go by, then you start stretching until you are comfortable. Sometimes it may take up to a week, sometimes up to 2 weeks. With that, we don't want you to be doing any strenuous exercises, and you're not going to be lifting any heavy object. And as much as possible, up to 6 to 8 weeks, no lifting of heavy objects. After that, you can go back to your normal duties. You are not restricted in any way at all. You can go back to any activities at all. Whichever activities they want to talk about, you can go back to any activity at all.
So, but but immediately after the surgery, can you still wear your waist beads or wear your wrapper, or you still have to?
We don't advise you to wear the waist beads, because at that point there'll be some swelling. Sometimes you may have So, and even for surgery, because of the equipment we use, the diatemy, if you are wearing, waist beads, sometimes they conduct electricity, and that can cause burns around the waist. So we don't advise any form of waist beads or any chain around the waist or even the ankle. when the swelling goes down. So sometimes we have people developing what we call lymphatic massage, where you go after your surgery to have some form of massage to improve, to drain out the excess fluid. It helps. I mean, I don't have any particular person I'll send you to. It depends on you. I mean, literature, well, I mean, the outcomes are not, are the same, whether you have lymphatic massage or not. But, sometimes we want to treat our mind. So I won't prevent anyone if you want to have your lymphatic massage. Not at all.
Okay. My last question is from myself, and from a medical point of view. I've seen patients in my practice where they've gone to Turkey and, they've gone to do tummy tucks and, what have you, and they've come back and they have problems. So obviously we know you've spoken about the complications already. My question is, does it affect your internal organs in any way? So for example, we know that when you've had a C-section or any abdominal surgery, you can get adhesions, or you can get, anyway, I don't want to get too technical, but in a way, once you've had a tummy tuck, does that sort of restrict you again in terms of your internal organs? Does it make you more prone to developing some complications in your abdomen, or does it restrict you in what kind of surgeries you can have in the future? Things like that.
Not at all. Well, as I said, tummy tuck is a very safe, very effective cosmetic surgery. It doesn't affect. Usually, we work on the anterior aspect of it. We don't go inside the abdomen. The only time that the abdomen is entered is when you have the gynae having surgery, combined surgery with the abdomen, where they go and they take out the uterus or the uterus. And then we'll combine it, but mostly we don't do. And then in some cases when you are repairing the hernias, the small hernias that are found there, you don't necessarily enter the abdomen. You just try to, be on the surface mostly. So the internal organs, it doesn't affect any future surgery. The only thing I spoke about is future plans of having pregnancies that may undo some of the things that we may have done. So if you want to have, you want to give birth in the future, we advise that you go finish with the pregnancies and come back to us to have. But we've had cases of, people who have, so they don't institute any family planning method, but they tell you, I'm not having any more babies. You have their tummy tucks. And then they've had it, and then still come with the pregnancy. Well, you can't stop them in a way, but we try to advise people to come after they are done with their pregnancy.
Actually, says you can actually because. Okay. Well, for your own bragging rights, how what would you say your percentage of successes with these cases? Not even success. Obviously, I think it's not like an emergency case, but patient satisfaction rate.
Satisfaction. Oh yes. We had a lot of them, right? Writing back to us, posing with the pictures back to us, and telling us that they've gone back to change their wardrobe. Wearing now they can show their tummies. And then
great satisfaction.
Yes. And that when you do your self-confidence, your image, body image, they tend to walk places without and it's quite pleasing to hear some of them that talk about the outcomes. As I said, for every journey, there are risks. Possible a minor risk, a major risk. We try as much as possible to lower the risk, and our outcomes have been very, 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 very good. Very, very, very good. I know people talk about, Ghana, what can they do? Ghana, we do anything. We have the risk. We work, and we worked in the UK. We work here. We do, when we have the resources, we're able to do the best for our patients, and we have equally good anesthetists and very good nurses as well to take care of the patients. And we have executive wards. You go there, nobody really knows that you've had surgery. If you want to come in incognito, no one will see you under the radar. Yes, but it comes with a little more cost because you have to do it out of hours. We're happy to do all that. It's done. It's done. Anyway.
Absolutely.
We actually are happy to.
Yeah. Well, everybody knows that you're my friend here, so I might be a little bit biased, but you can put me down on your client list for when I'm done. When I'm done with my
when you are done.
You've definitely got one client from me. And if anybody wants to get in touch with you, or for me again, I just want to state my disclaimer. I'm obviously biased because he is my friend. So maybe I'm plugging him, but if you're trying to get it done here in the NHS, you're going to be on a waiting list. It's definitely going to be cheaper if you fly. Even if you add your flights and things and you go to Ghana, it's still going to be cheaper. And I'd rather advocate for Ghana than places like Turkey and things like that, because from my experience, I've never had a client who's come back from Ghana who's had a negative experience, whereas all my patients who's ever been, not well, a lot of patients who've been to Turkey have come back with complications. Not because they're not.
The sad thing about going to Turkey is
you just don't know who you're going to get. You don't know that this person is certified. They might not even be a surgeon. They might be a butcher, so you never know. Yeah. No, you were saying something.
Yeah. I mean, with Turkey, because of the numbers, yes. I was saying that with Turkey, they have the numbers. So sometimes you go and like within two days, you are out of the place. You have to come back to Ghana. For us, we try to make sure that if you are coming from anywhere, Europe or the US, we have clients who come from the US, we have clients who come from UK. Once we make sure that you have enough, holidays, so at least we can follow you up just for like 2 weeks, or if you can, or a month before you set off. But if it's just liposuction after 2 weeks, you can even go back without any problem at all. Because usually liposuction you don't. But we're talking about tummy tuck, so let me say on tummy tuck. Because we want the full recovery up to 1 month. You can go back if there are no wound complications. You can go back.
Absolutely. And I think somebody's already jumped ahead of me, because the next thing I was going to ask you is, where can we find you? But before I say that, obviously, even like you say, if you're traveling from Europe or USA, before you get to Ghana, you'll have online consultations. You'll have, there's a whole process for this. So you're not just going to get up today, say, I'm going to Ghana tomorrow. There'll be conversations. So they'll advise you and tell you how long you might need to take off, how long they feel it might take. They'll take pictures, do the whole online consultation thing. So Dr. Davis, I'm going to leave that to you.
Yes. So what we'll do is I can put up my hello.
Go ahead.
Can you hear me?
Yes, I can hear you. It's just a bit slow, but I can hear you. Oh, maybe he's lost us.
Oh my God.
You're still here. We can hear you. You can't hear us, I think. I think we've lost him, but he will come back. So he's just going to put on his details on how we can find him. I think he might just pop back, or if not, I can take the details and share them with you later on. But it's certainly, if you're thinking about it, somebody who might be considering this, it is definitely more expensive in Europe, and much safer in Ghana than other places that are not certified. So it's something worth thinking about. Oh, I think Doctor, he's gone, but he'll come back, I'm sure. So yeah, I think if we don't have any more questions, do we have any questions? My usual people are not here to talk. Where's Auntie Comfort? Where's Auntie Liz? We're missing you today.
We are listening this week.
Sorry, Dr. Akos.
Yeah.
I was late because I've been waiting to just get the message for tonight's this thing, and 8 o'clock I checked, there was nothing, so I just thought a holiday my.
Oh, W. The message has been on.
No, it's not. It just came on 8:01.
Oh, okay.
Yeah.
Well, sorry to hear that.
So that's the reason why I was busy cooking. So.
Okay.
Yeah. So today there's no question.
No problem. Well, thank you for being here. It's always good to have you here. Auntie Amma, did you want to say something?
Me try some from Kakra, don't worry. I've got too many surgeries, so no, yeah, but I'll go back and listen on this in YouTube, and then
if you've missed it, I mean, it was really, really good. We've got it all on YouTube, and as I say, thank you for those watching from YouTube. I can definitely see you I can see you there, and there's so much more people watching on YouTube now. If you've got any questions on YouTube, please do pass it on. We're going to try and get him back if he's not able to join back today. But get him back.
I'm here, actually here.
Oh, hi. He's here. So,
Dr. Kwaba.
How do we find you, Dr. Davis?
Oh, yes. So I'll put on my number, and then I'm with Lekma Hospital, and I'm with Kolebu Plastic Surgery Unit. I'm trying to set up in Lekma Hospital, but most of my cosmetic surgeries are done in Kolebu, where we have Kolebu Plastic Surgery Unit. But I would ask Akusia to put out my number. I'm happy to receive calls or WhatsApp messages, and I'm happy to chat with anyone who wants to have a consultation anytime at all.
Well, thank you so much. I think I'll contact you.
Fantastic. Well, thank you so much for your time and your hard work to Dr. Davis. Honestly, I've learned so much, and I think it's something that is definitely worth spreading to friends and family who might be interested, or even if it's just for information or like an initial consultation. Please do let them know Dr. Davis is here to answer any questions they have. Dr. Davis, do you have any last words for us, words of encouragement?
Well, as I said, we shouldn't resort to surgery as the first line, but I mean, in some cases we can't help it because of the multiple pregnancies and any other conditions that we may have had. Yes, surgery can help you. We can have tummy tucks, but I'll be reminded that we don't do liposuction and tummy tucks as a procedure for weight loss. And let's live a healthy lifestyle. Eat well. I'm sure the dietitian would expatiate on healthy eating and healthy living at the next talk. Thank you so much for having me, and I'm looking forward to having more conversations individually with any prospective client.
Absolutely. Thank you so much. All right, so we'll just do our daily sort of housekeeping when we're closing. So once again, thank you all our faithful watchers for coming on, the ones who come on time. Honestly, so fortunate to have you guys, and everybody who even if you come late, we know that some people are working, some people are not able to make it here on time for various reasons, but we just thank you for taking time out of your busy schedules on a Wednesday evening every week to come and join us. Please do spread the word to your friends and family, so that we can get more people to come and hear these words of these very important medical conditions and, these opportunities that they might not hear on a daily basis. And we also to thank OT Media and TAPTAP Send for giving us this opportunity. Remember, every Thursday, so tomorrow as well, there's a time with TAPTAP. So that's every Thursday, 8 o'clock, time with TAPTAP, and every Friday is Ask the Lawyer. So remember to tune in, because from Wednesday to Friday, OT Media have all these shows planned for you. Once again, thank you today for tuning in. And I'm putting our details. So if you want to follow myself, my sister, the host of the show, you want to follow us on social media, I'm Dr. Akos on TikTok. I'm going to put my link there. I'm also going to put our link on Instagram and our WhatsApp number or details if you want to contact us. But in the meantime, have a good week. Enjoy your week, and we'll see you the same time next week. Thank you.
TAPTAP Send.
Thank you.
You're from Calabos. The only boss.
Good night. Thank you, Dr.
Which one is? Baby, I will be everywhere I day and everywhere they go. TAPTAP Send got me covered. If you need to send money or transfer money from Europe, from Canada, from USA, from UK, any part in Europe, you can send it through TAPTAP Send. And guess what? Oceania, they will receive it right here in Ghana and many countries across Africa. So what are you waiting for? Download TAPTAP Send now on Google Play Store or App Store. When you download, it's so easy to use. Tell your families, tell your loved ones to download TAPTAP Send. Okay? But also, when I receive my money, the other time the world would challenge, like my view, hey, you crazy.
Download TAPTAP Send now on Google Play and App Store. TAPTAP Send. It's secure, convenient, easy, and fast.
My chef and party planner. You know we can't get this retirement / birthday shindig go wrong. Everything is almost ready, but Small problem.